Mrs. Ella Jenner is just admitted into Ward A with chest pain. A nurse is going to interview the patient. Hello, Mrs. Jenner. My name is Pontiff Simon. I'm a nurse here. I would like to ask you some questions. Will this be okay with you?
Sure, no problem.
What brings you here today?
I feel weak and have chest pain, difficulty in breathing, a lot of swears, dizziness, and vomiting.
How long have you been feeling like this?
3 hours.
Do you still have chest pain?
Yes, I do.
If a pain score is from 0 to 10, 0 means no pain at all and 10 means severe pain. What is the level of your pain?
5.
Have you had any major illness?
Yes, I have had hyperlipidemia and high blood pressure.
May I measure your vital signs, please?
Okay.
You have no fever. Your heart rate and respiration rate are faster than normal. Your blood pressure is a bit high. Please take a rest. A physician will be coming soon. If you have any problem or need help, please let me know.
Thank you very much. The physician came to interview and examine the patient. After that, he had ordered blood tests, chest X-ray, EKG, echocardiography, and coronary angiography or CAG. A nurse is coming in to inform patient about the physician's order, take blood, perform EKG, and send the patient to the echocardiography clinic. Good morning. How are you feeling?
I'm a bit tired, but have no chest pain now.
Good to hear that. The physician had ordered for blood tests, chest X-ray, EKG, echocardiography, and coronary angiography or CAG. Firstly, I would like to take your blood sample for the test. May I have your arm, please?
Yes, of course.
Now, I would like to do the EKG, please. Lie down on the bed and relax. This will take about 5 to 10 minutes.
Okay.
Please be ready in 10 minutes. I will send you to the X-ray room, then the echocardiography clinic.
Okay.
After the physician receives the results of blood test, EKG, chest X-ray, echocardiography, and CAG, she is coming to talk to the patient. The results of your blood tests and other examinations are already arrived.
Really great.
Your blood test shows a high level of LDL and triglyceride. The level of your cardiac enzyme is also elevated, which indicates that the heart muscles may be injured or may not be getting enough oxygen. Moreover, EKG and echocardiography show abnormalities. The result of CAG show that two blood vessels in your heart are narrow, and they can cause lack of blood and oxygen supply to your heart muscles. Therefore, I have planned for you to do the balloon angiopathy.
Oh, really? Can you tell me what it is?
It is a procedure which helps to enlarge the coronary arteries to allow the blood to flow better to the heart muscles by inserting a catheter similar to a balloon into the blood vessels. When it reaches to the narrow area, the balloon will be inflated to push the pump in the blood vessels to the vascular wall. A nurse will come to explain what you have to do before, during, and after balloon angiopathy later. Please take a rest.
Okay, then a nurse is coming to explain about the procedure of balloon angiopathy and what the patient had to do before, during, and after balloon angiopathy.
How is the balloon angiopathy performed?
The surgeon usually perform this procedure while you are under local anesthesia. First, they make an incision in your arm or groin. Then they insert a catheter with a tiny inflatable balloon on the end into your artery, using X-ray video and spatial dye to guide the catheter up into the broad coronary artery. Once it is in a procedure, the balloon is inflated to widen the artery. The further process or back in bit push against the wall of the artery. This clears the way for blood flow.
How long does the procedure take?
About 1 to 2 hours.
What should I do before the procedure?
You have to refrain from water and food about 6-8 hours before the procedure. Before going to the cardiac, catheterization room. You wish not wear any jewelry and danger. Take your underwear or wear the coat that the stars give to you and empty your bladder by urination.
After balloon angioplasty compression, are there any complications?
You may have an allergic reaction to the anesthetic and the dye used in the angioplasty. Some other risks associated with coronary angioplasty include bleeding, clotting, or bleeding, and the price of insertions but cause forming in the state, and directional heartbeat, damage of a blood vessel, heart valves, or artery, a heart attack, kidney damage. Then the infection. This procedure is also associated with the risk of stroke, but the risk is low.
Oh, really?
The surgeon will be very careful to perform the procedure.
I know.
Do you have any question?
No.
If you are going to have the procedure, please cite in this information consent form.
Okay. Is giving advice to the patient about how to prevent the recurrence of coronary artery disease or CAD. Today, I would like to give you the knowledge about the prevention of coronary artery disease or CAD. Do you know anything about it?
No, I don't. Please do explain.
This is the most common form of heart disease and is also the leading cause of death. This occurs when the coronary arteries that carry blood to your heart get blocked with plaque. That plaque collection is called atherosclerosis. Plaque is made of elements including fat and cholesterol. Over time, plaque can harden inside the walls of your arteries.
What are the symptoms of CAD?
You may experience chest pain, tightness in your arms, back, the back of your neck, or jaw, shortness of breath, and heart attack.
How is CAD diagnosed?
A physician will perform a physical examination and ask some questions related to your symptoms, family history, diet, activity level, and other medical conditions. If he suspects you to have CAD, he may order one or more tests for investigation.
Can CAD be prevented?
This can't be completely prevented. However, you can reduce the risk for getting the disease by controlling your blood pressure, eating healthy foods, exercise regularly, take medicines as prescribed, and see a doctor following the appointment.
Thanks for your advice.
Good morning. Today we are going to do a pre-conference of the patient. Bed 9, Mrs. Aura Jenner, age 69 years old, and admitted on May 31st, 2020. Because of chest pain, difficulty in breathing, a lot of sweat, dizziness, and vomiting. The physician had diagnosed myocardial ischemia and ordered for balloon angioplasty this morning. I would like to discuss with you about complications that may occur after the patient comes back from the surgery. What do you think can be the possible complication?
I think the complications can be bleeding and infection at the catheter insertion site.
I agree. Cardiac arrhythmia can also be a complication.
Right. Can you tell me the three most significant nursing diagnoses of the patient after undergoing balloon angioplasty?
I think risk for bleeding related to the catheter insertion and risk for decreased cardiac output related to cardiac arrhythmia.
May I add one more nursing diagnosis?
Yes, please.
I think risk for infection related to the catheter insertion is also important.
That's right. What do you think is the nursing interventions for the leak for the bleeding?
Check a ditching for any oozing or bleeding for the puncture site. Assess skin around the site for purple discolorations. Assess the puncture site every 30 minutes for 4 hours, then every hour until amputation. Recheck the site after first amputation and then a minimum of 4 hours prior to ditching. Do not remove a ditching unless the physician orders, and advise the patients to remain on the bed for at least 6 hours.
What are nursing interventions for leak for decreased cardiac output?
I think we should monitor vital signs, oxygen saturation, and EKG, assess symptoms such as fatigue, chest pain, cold skin and extremity, increased respiratory rate and heart rate, dyspnea, alteration of consciousness, and edema.
We should also record intake and output, listen to heart and lung sounds, and examine laboratory results such as arterial blood gas, electrolytes, and cardiac enzyme.
How about nursing interventions for leak for infection?
We should monitor the body temperature, assess the puncture site for heart, pain and leanness, and also assess for other signs of infection including an increase in temperature, tachycardia, and rigors.
We should also administer antibiotics and other wash hands and use aseptic technique.
Don't forget to monitor laboratory results such as white blood cell, neutrophils, and cultures.
Okay, your nursing interventions sound good to me.
At 4 p.m. nurse 1 is going to give a chip report to nurse 2 and nurse 3.
Today at 9 a.m., Mrs. Jenner was sent to the surgical room for balloon angioplasty and came back to our unit around noon. Based on the patient's condition, there are 3 most significant problems, which are risk for bleeding, risk for decreased cardiac output, and risk for infection. Since she came back, her vital signs have been normal. There are no signs of bleeding and infection at the puncture site.
How about EKG and oxygen saturation?
EKG shows normal signaling and oxygen saturation is about 98 to 100%. Now, she is on cannula with oxygen 3 liters per minute. She had no chest pain, dyspnea and cyanosis. She is resting on the bed, most of the time in a semi-fallow position.
Did you listen to her heart and lung sounds?
Yes, I did. They both are normal.
How about urine output?
This is 400 milliliters within 4 hours.
Okay, then we will continue having observation on this patient.